Welcome to Ask Dr. Tommy O. This is an affiliate program of Church Alive Community Church. Stay alive with Church Alive. And Dr. Tommy O is our featured guest, and certainly he is your resident doctor. I say that because he's coming to your home so many times, bringing you quality information, resources, and services about health. And so our topic this time is obesity. Welcome, Dr. Tommy O.
Thank you.
Dr. Tommy O, when we're talking about obesity, what really are we talking about?
Oh, well, obesity, we're talking, it's a definition. I'll define what obesity is. Obesity, we define as a body mass index that's greater than 30% or 20% over ideal body weight. And this is formulas that was developed by scientists and those individuals who are in the health fields who specialize in obesity and weight. They came up with formulas to define what obesity is.
Okay, now what are some of the common obesities? And when people are talking about you know, population and percentages and whatnot, they usually comes up with a common level of obesity. What would that be?
Right. Well, obesity is at epidemic levels throughout the entire country.
Yeah, and especially in the Bronx, and we're going to talk about that a little later.
Yes. It is estimated that 70% of the population in America is overweight, with approximately 30% obese. That's pretty significant.
That is very significant. Now, I think that in this area, there are many different factors that we have to look at. And so we are going to quickly go into some of those areas, that, where people can really see how bad obesity is run rampant throughout the United States, and especially in the Bronx. When we talk about that, we're looking at the New York Department of Health and Hygiene, June 2003. They have given out some real vital statistics for us to be able to explain to people. Now, what about these statistics when it comes to New York City?
Right. Well, we had, like, what I like to do is, before we get into that, just so the audience understands, each show I like to bring in statistics so you can have a really good understanding of how significant disease is.
And these are facts.
And these are facts coming from peer-reviewed journals, associations that are involved, and that's what they do. They focus on one specific area. Again, as you said, New York City Department of Health and Hygiene, dated June 2003, titled New York City Vital Signs. They suggest that 53% of New York City adults are overweight. 53%, that's more than 50% of adults in New York City. That's all 5 boroughs.
Now, when we going one step further, let's break down the boroughs a little bit so we can get an understanding, because I just mentioned we'll find out about the Bronx.
Right.
Go right ahead.
Okay. Based on these studies, obesity levels are highest in the Bronx at 24%, followed by Brooklyn, which is 21%, Staten Island 18%, Queens was 16%, and Manhattan 13%. And just to reiterate, we had in the newspaper, local newspaper, about a year ago, which stated that the Bronx had the most obese population out of all 5 boroughs. And right here, this again, the New York City Department of Health and Hygiene supports those findings as well.
Okay, now we're looking at areas such as Harlem and the South Bronx, and the way the statistics is showing me is 1 out of 4 obese. This is unbelievable. In Harlem, South Bronx, and East New York. All right, but then we have to look at the difference between men and women.
Right. Well, again, based on these studies, the studies suggest that men are more overweight than women. However, women are more obese than men. So let me go through this again, because when you hear this,
because
what does
I've
that mean?
seen some big women. You know?
Right. And so let me just,
especially in churches.
Exactly. Let me just go read this in their words. More adult men are overweight than women.
Right.
Yet more adult women are obese than men. Okay. What does that mean? That means
well,
that
there's 2 words here. I know. I hear.
Right. We have
one
overweight
is and
obese.
Right.
Okay. Now, overweight is defined at 10% over ideal body weight versus obese, which is 20% over ideal weight. So more men, or 10% over their ideal body weight
Right.
than women. However, 20% the women are 20% over ideal body weight, meaning that they're obese. I know that's a tongue twister
Yeah,
there.
I know what you're saying really is
tough.
that men are overweight, but women are beyond just overweight; they're obese.
Right.
Okay, which is really a major problem with women. Okay. Okay. Now, when we break it down, we look at the areas of African American and Hispanic in New York are more likely to be obese than white or Asian adults. I know there's some more insight into that.
Right.
Can you want to talk about that a little bit?
Yeah, part of it is due to the socioeconomical environment that these individuals live in, as well as cultural. You know, if you're Afro-American, your roots are from the South, and your diet is more Southern in nature, it's going to be a lot higher in fatty diets or saturated fats. It's going to be high in salt as well. With the Hispanic population, their diets are high in carbohydrates, specifically in the rice, the beans, the breads, and the fried chicken, or even the pork. With this, will again raise the obesity levels.
Right. Now, also, I understand in these statistics, it says obesity is more common among poor people.
Yes.
And more than 1 out of 5 adults. You want to look, what kind of percentage is that?
Again, that's pretty significant and staggering. You know, 1 out of 5 adults, if you just look around, you can count 5 people, you know 5 people, just 1 out of 5.
Well, that's like 22% from what the statistics is showing me.
Yeah.
With a household income of less than $25,000. That means they're not making a lot of money, but they're eating very poorly.
Right. Well, that statistics ties into the statistics that 1 in 4 adults are obese in Harlem and the South Bronx as well as East New York. If we go through demographics based on income, in those areas, I'll give you an example. In the South Bronx, the demographics suggest that income is anywhere between $12,000 to $18,000 a year. So when you look at those numbers and you look at the South Bronx being one of the most obese sections of the Bronx, well, there you go. There's the correlation.
Right.
The lower income with the obesity. And again, this isn't a broad statement just because your income is not high that you're automatically going to be obese. That's not the case.
No,
just
because,
that you have.
Yeah, because we look at 14% of adults of comparable households are greater than $50,000.
Right. Well, it's based on culture. It's based on how proactive you are, how involved are you with your own health, exercise, you know, the educational component. And that's very important. That's what we're here for, to offer that educational component.
Right. So these statistics really don't say, are not points in fact, that if you're poor, you're going to be obese. And
Right.
It's basically just statistics to show that there is a sociological problem in this area.
It's based on risk factors.
Risk factors, yeah.
Again, that's what I focus on. And in medicine, especially in my practice, I focus on addressing those modifiable risk factors.
Okay.
We reduce those risk factors, then we have an increased risk for having a good health.
What does the American Journal of Public Health September statistics say, September 2004? What are they saying?
Yeah, this is a very interesting article, and I looked this up, and again, this was based on elementary students in New York City. They studied 3,000 students, and about 43% of these 3,000 students were diagnosed as being overweight. And they broke it down into statistics on the type of